County says COVID-19 misinformation continues to be a problem and once again had a panel of doctors review comments that were made at yesterday's board meeting.
Today, that independent panel responded to some of the more attention-grabbing claims made at the meeting. News 8's Kelly Hassedall joins us live from the County Administration Building with what the doctors had to say today. Kelly?
Carlo and Heather, the panel went on for about an hour. They certainly had plenty to talk about. Now, here's one comment that got a lot of attention, and here's one doctor's response to it.
Ivermectin, not just horse paste, and hydroxychloroquine, vitamin C and vitamin D, then the zinc and quercetin. I won't wear a useless mask. I don't need to stay at home.
On the NIH website, they run through 25 studies of ivermectin, and it's just not impressive. It, almost exactly equal to placebo in terms of many of the outcomes. And the few studies that have been positive showing an effect of ivermectin have been withdrawn because the data was falsified.
And Dr. Christian Rommers, whom you just heard from, also said hydroxychloroquine was also proven ineffective, and in some cases it's caused harm in patients. Now, the panel today also addressed misinformation about the safety of the vaccine. The doctor said again and again, this vaccine has been studied far more than other vaccines. It is safe. They say any serious side effects are rare. The panel spent several minutes discussing the fact that the vaccines work, that even though breakthrough infections happen, they still prevent people from getting seriously ill, which is what they are meant to do. Now, at the end of the discussion, they addressed this idea that COVID is a conspiracy.
This is a message from an earth angel. Your time is up. God sees all your wicked ways, and it's time to end it. You're hurting and killing innocent people.
People that go to work for the CDC or people that go to work for the County of San Diego's Public Health Department don't have an alternative agenda. We all just want to use the facts to protect our populations, and we have very clear evidence that the vaccines are safe and effective.
And the doctors talked about how frustrating it is to have patients come in and quote them false information they read on the internet. They say that is why, these panels are so important. They say they're going to continue to fight back against misinformation as long as they have to. Carlo and Heather.
Yeah, they seem to be getting a little more outrageous every time we see these. Kelly, singing now. Oh, boy. So the Omicron variant, we've all been discussing that. It's emerged over the last couple of weeks. Was that discussed at yesterday's meeting? And what did the doctors have to say about it?
Yeah, it was brought up at yesterday's meeting. There seemed to be this idea that the only reason the Omicron variant is out there is because, they need to continue to give us booster shots over and over again, whereas the doctors pointed out today there are plenty of vaccines that require booster shots, not just this one. They also wanted to put out there, even if you've recovered from COVID-19, you should still get a vaccine. That natural immunity is not going to protect you from the Omicron variant.
All right, Kelly Hassedall reporting live outside the County Administration Building. Kelly, thanks.